Hi everyone, I'm Michelle, a doctoral student from Nanyang Technological University in Singapore and one of the authors on this paper on the intergenerational study of parental bonding on perceptions of parental and spousal criticism. Criticism is a form of interpersonal social rejection and destructive conflict behavior which has been associated with poor relationship outcomes in both parent-child and marital relationships. However, the role of the individual's perceptions of parental and spousal criticism in influencing the perceptions of criticism of other members in the family unit has not been examined previously. So in our study, we investigated the associations between parental bonding and perceptions of parental and spousal criticism across generations in Singapore. The spillover hypothesis, coupled with findings from the empirical research on interparental conflict and intergeneration transmission of parenting, form the basis for our model in our study. Firstly, based on the findings that levels of warmth in the parent-child relationship influence an individual's perception of threat in interpersonal context, we expected parental warmth to influence perceptions of parental and spousal criticism. In line with findings of intergeneration transmission of harsh parenting and psychological aggression, as well as the tendency of individuals to learn parenting behaviors from their own parents, we proposed that perceptions of G1 parental bonding and parental criticism will influence G2 parenting and consequently predict G3 perceptions of G2 parental criticism. Secondly, based on findings in previous studies conducted in this field, which have demonstrated the relationship between perceptions of criticism of partners and relationship quality, and research on interparental conflict, we expected that perceptions of spousal criticism will predict perceptions of marital relationship quality. In addition, given that parents tend to emulate one another in terms of parenting behaviors, and evidence suggesting the role of co-parents with supportive parent-child relationships in disrupting the intergenerational continuity of harsh parenting, we propose that perceptions of spousal criticism will influence one's own parenting behaviors. Hence, we tested these three hypotheses in our study that you see on the screen. A total of 134 married parent couple dietats and their children were recruited for the study in Singapore, and G2 participants completed a questionnaire with the following measures: the perceived criticism measure for their parents and spouses, the parental bonding inventory, and the quality of marriage index for the relationship with their spouses. G3 participants completed the PC measure for their parents, which were the G2 participants in the study. We conducted correlational analysis as well as multiple group path analysis using maximum likelihood estimation. Our findings indicated that G2 perceptions of G1 criticism were associated with G3 perceptions of G2 criticism, as well as G1 parental bonding being associated with G3 perceptions of parental criticism, which suggests the continuity in perceptions of criticism in the parent-child relationship across 3 generations. Given the established link between criticism and psychopathology, such as depression, the results reported in our study suggest the possibility of the role of parental criticism in the intergeneration transmission of psychopathology. For example, previous studies have indicated the association of maternal depression with lower quality of parenting and problematic caregiving practices. In line with this notion, parental criticism may be one such problematic parenting practice that contributes to the intergeneration transmission of psychopathology. Hence, the role of parental criticism as a possible proximal risk factor in the intergeneration transmission of harsh parenting can be further investigated in research conducted on parenting across generations in future. Characteristics of parent-child communication that act as proximal protective factors in breaking intergeneration continuity of parental criticism are another possible direction that can be explored in research conducted in future in order to further extend on our findings. G2 PC ratings from patients, as well as G1 PC ratings from patients' parents, may serve as an additional source of information into proximal risk factors of patient outcomes for clinicians treating mental health disorders that are related to PC, although more empirical research and clinical samples are needed to provide support for this recommendation. In addition, this study also aligns with previous studies in raising awareness of considerations of social cultural contexts in which parenting is embedded when studying and interpreting parenting practices. The findings in our study seem to be in line with growing evidence suggesting that parental control in Asian contexts may not have the same connotations and undesirable effects on child outcomes in Western contexts. Marital therapy and parenting advice can also consider the inclusion of recommendations targeting conflict patterns, specifically for criticism, where clinicians can consider making use of PC ratings for spouses as well as PC by the couple's children in addressing detrimental conflict behaviors contributing to relationship degradation. Additionally, parenting education can also address the implications of the marital relationship and interparental conflict on the parent-child relationship, parenting practices, and consequences on child adjustment and development. Thank you for watching our video extract. You can find our full open access article on family process, and if you have questions about our study, you can also contact our corresponding author at the following email that you see on the slide. Thank you.